to see you. I felt like it wasn't that long ago since I've seen you, but I guess it's already been a year. Crazy. Anything new? You missed your period? Is this the first time something like that has happened? Okay. When exactly was the first date of your last menstrual period that you have recorded? Okay. Are you having any bleeding or cramping today? No? And is there any chance that you might be pregnant? Possibly? Okay. We will check for that today then. Now, if you are, what are your thoughts on that? Okay. Okay, so you weren't necessarily preventing, but you'd be, okay, good. And do you feel like if you were pregnant, you would have good family support? Do you believe the father of the baby is relatively, he would be supportive? Good. Love to hear it. Now, just general questions that I've had to ask in the past. Any new medical conditions since I last saw you that I should be aware of? Any surgery since I last saw you? And you don't smoke or drink, right? Good. Any new family history? All right, and it looks like you would probably be due for your pap smear at this time as well. But we're gonna just collect a urine sample and then we'll kind of take it from there to see how the pregnancy test comes back. Have you taken any at home? No? That's totally okay. So let's see how this urine sample comes back. I'm gonna do your vitals real quick, and then I'm going to give you this cup. You're gonna leave me a urine sample, and then you're gonna get undressed waist down as you would a pelvic exam and pap. And so we'll see if we'll be doing more than an annual today though, okay? Exactly. Let me take your temperature first. Are you feeling any nauseousness, breast tenderness? A little bit. Okay, all right. Now this is going to go right under your tongue, okay? Just gotta wait a few seconds. You're not feeling any fever or chills, right? Good. Perfect. Temperature is great. And let me just grab your blood pressure, and I will let you go use the bathroom, okay? Perfect. This is going to be an automatic cuff that's attached to the machine here. So I'm just going to place it around your arm. I think that's tight enough. Start the machine. All right, perfect. Blood pressure is very good. Yes, that's excellent. Okay, let me put this cuff away. And then what I am going to do is I am going to give you this cup right here. Like I said, you can leave the sample in the bathroom for me. I'm just going to dip it for a pregnancy test. And then I will meet you back here. And then we'll get the exam portion going and maybe talk about it a little bit more depending on the result. Perfect. All right, I'll talk to you in a second. So, pregnancy test was positive. Now, are you still okay with me just getting your pap smear over with so you don't have to do it? Okay, all right. Now, based off of your last menstrual period, you're pretty early on in pregnancy, around 5 weeks. So with that being said, I'm gonna put in an order for you to get an ultrasound in a couple weeks, because at that point we should hopefully be able to get heartbeat and confirm your due date. A lot of overwhelming emotion, feeling. Yeah, but happy? Good. Okay, so I'm gonna do a quick pelvic exam. If I see any abnormal discharge, we'll swab you for vaginitis. I'm gonna do your pap smear real quick. Now, something I always tell my patients is not to worry. The pap smear is just taking cells off the surface of your cervix. Baby is all the way in your uterus, so know where I'm getting there. Yep, yes, exactly. Okay, so you have done your scoot down, you already know. Let me grab a light here. All right. Just grabbing the speculum. Let me get it under some warm water for you. Yes, of course. All right. Now I take it that you're not on prenatal vitamins yet? Okay, we'll talk about all that in a second. You're gonna feel my hands here. All right, cervix is nice and closed. Let me get the pap container. All right, brushes here. Okay. I swear, so much noise from the outside. All right. Now we're going to do some standard infection screening today with another swab. It's just because you're pregnant now. Yep. All right. Let me close up the specimen container. Now the last part of the exam is with my fingers. Take this out. Now the exam with my fingers is typically done so that I make sure I don't feel any masses on either side of where your ovary is. Something I always tell people is when you're this early on in pregnancy, we can never be 100% sure where the pregnancy is. We can't always assume that it's where it should be, in the uterus. So there are situations where people may miscarry, where people have ectopic pregnancies in the tubes. So this sort of rules out a general, no masses felt on either side. And to confirm, you haven't felt any pain or bleeding. Good, okay. You're okay with the manual exam? Perfect. All right. All right, you're gonna feel that pressure. Excellent. Okay, let me take these off. And so today we are going to be getting blood work on you as well. It's just kind of the standard routine blood work. When we see you in a couple weeks for the ultrasound, you can sort of update us. Now, one thing I always tell people is please trust your instinct. If you are in severe pain, if you start bleeding, you are to go straight to the hospital to rule out an ectopic or miscarriage, okay? Yes, please don't ever ignore it. Let's kind of go over general rules of thumb when it comes to diet, exercise, weight gain expectations in pregnancy. Yep. So the good news is you have a relatively good health history, which is great. I am going to provide you with this packet here of information, but I kind of wanted to go over a few standard things. Yep. Of course, course, call us if any concern or question. I'm going to be giving you a safe medication list in pregnancy, and I'm going to be sending you home with some prenatals. Now, if you are ever in pain or uncomfortable, Tylenol is always the answer. You cannot have any NSAIDs, so no Motrin, Advil, ibuprofen, none of that. A good multivitamin or prenatal vitamin, most of them are good that are over the counter. You just want to avoid the gummies because sometimes they may not have the exact ingredients that you need. The two specific things to look out for are iron and folic acid. In your prenatal vitamin, you want at least 15 to 30 milligrams of iron. And for folic acid, you want at least 0.4 to 0.8 milligrams. I will write this all down for you. All right. When it comes to diet and pregnancy, wash your fruits and vegetables, of course. You want to avoid anything unpasteurized, whether it's juice, cider, milk. That includes soft cheeses like brie, feta, queso. You want to avoid any pre-made salads, so don't get any of the, chicken salad or tuna salad that they may serve at the grocery store. You want to avoid anything raw or undercooked. I know you like sushi. Yeah. You want to limit the consumption of fish that are high in mercury levels. And I could print off a list of the specific fish. Yes, exactly. Like a little bit here and there is okay, but just not every day. Lunch meats. This one I feel like is very highly debated. But if you're going to eat deli meat, like the cold cut turkey, bologna, that sort of thing, you want to always heat it in an oven or microwave before consumption. Yeah. You can still have caffeine, but you want to have, I believe it's 200, less than 200 milligrams a day. Absolutely. And do you have any cats at home? No more changing the litter box for you? You've heard of that? Yeah. All right. Based off of your current BMI, we would have a weight gain. Normal weight gain range per the CDC would be around 25 to 35 pounds. Now, I say that very lightly because I find that patients can eat perfectly. They could be exercising in pregnancy, and some patients just may retain more water than other patients. So this is definitely something we'll just keep an eye on. Make sure you're feeling well, but I wouldn't, be too hard on yourself as far as the number, Yeah. Of course, you don't want to smoke, you don't want to drink, which I know you don't do any of those. Exercise is highly encouraged. You want to do what your body is normally comfortable with. We always encourage walking, 30 minutes a day, 4 to 5 times a week. Be very good. But you do want to avoid things that involve a lot of sweating, hot tubs, hot yoga, saunas. Yeah. Sounds like you did some research. Flu and COVID vaccine are recommended in pregnancy, so if you ever change your vaccine status, you would let me know. Yes. Do you have any other pets at home? Good. So that is kind of an introduction. Of course, there are other topics we can talk about once the viability is confirmed on the scan. So I am going to give you a safe medication list in the meantime. And then I got some prenatal vitamins for you. You are going to take one of these once a day. If for whatever reason it makes you nauseous or you don't like taking these, let me know. I'll send you a different brand. Absolutely. Now, we deliver at the hospital. Yep, right over there. I do like to tell patients that early on in case they had plans to deliver elsewhere. Yes, exactly. So I will give these to you. Otherwise, that's kind of a brief intro. We'll definitely go over more details or answer any questions you may have at your next appointment. We'll get all the blood work here. We'll plan for the viability ultrasound in a couple weeks. Let me actually write an order for you. All right, you are going to take this to the girls up front. We're going to get a viability ultrasound. That'll confirm, baby's heartbeat, due date, and that'll be in 2 weeks because that's when we should be able to see what we have to see. And then after that, you'll see one of us for the OB intake. We'll go over more genetic history and stuff like that. And then we'll review all your labs at that time as well. Now, of course, if any of your labs come back abnormal, I'll be calling you sooner. Yeah? Perfect. You'll take your prenatals every day. And I know it's a lot of information, but I'll provide you with an educational packet. And then if you have any questions, you just contact me. Yep. Perfect. So I will plan to see you after your ultrasound. And again, any bleeding or cramping, you go straight to the hospital. Perfect. I'm so excited for you. I'm so happy for you. I'm praying for you for a safe, healthy pregnancy and baby. And I will see you shortly. See ya.